Hey y'all, it's Jenny from Flow. I wanted to share some self-help, self-care tips with you today, and all around the topic of headaches. So raise your hand if you've never had a headache. Right. Everybody gets headaches sometimes. In Chinese medicine, we consider headache one of the very first signs of a cold setting in. So sometimes that happens before you have any other signs or symptoms of a cold, and so that's one of the reasons why it's really important to treat a headache right away, because oftentimes you can treat it and treat what would be a cold that's about to happen and get it taken care of and not come down with a cold. But headaches can happen for all sorts of reasons, and so I wanted to share some acupressure points, which are the same points as acupuncture points, but you're going to put pressure on it instead of using a needle to stimulate it. And these are different points that you can use for headache. So not every headache is created the same. And so headaches are going to be happening if there is some external invasion in a channel, or if the qi and blood in a channel is not flowing correctly, or if there's not enough qi and blood in a channel. But depending on which channel is being affected, so if it's the gallbladder channel versus the stomach channel versus the urinary bladder channel versus the liver channel, you're going to have a different type of headache, and so different points are going to be the best points to use to treat that headache. So let's start out with the point that you probably already know about for headache, and that is this point right here. I'm going to draw it on here so you can see it. It's large intestine 4, and can you see it? Large intestine 4 right there. So it's called Union Valley, so it's kind of where your finger and thumb come together. See? And Union Valley or joining valley, Hegu. Large intestine 4. So this is kind of the classic headache point, and so to work this point or any of the points, you can hold it with a fair amount of pressure, or you can just very gently apply pressure, and the qi will show up there and go, what's going on, and it will respond to your touch. So you don't have to mash it, but you can, because sometimes with a headache it feels good to mash your hand and get your awareness away from your headache. So large intestine 4 is a great headache point for a number of reasons, but large intestine 4 or Hegu treats almost anything in the face and head and mouth. So it treats tooth pain or jaw pain, or many kinds of headaches. But the headache that large intestine 4 is best at treating is going to be a sinus-related headache. So sinus-related headaches in through here, it's going to have a strong effect on, or like anything, this sort of sinus area, and jaw pain and headache in this area. Any of those is going to be really good at treating. But large intestine 4 is what we call a command point. So it's the command point of the head and face. So which kind of means it makes almost anything in the head or face better. But that channel, the large intestine channel, ends in the corners of the nose, so it has a lot to do with like nasal and sinus stuff. So it can move that qi and really alleviate pressure in that area. So that's large intestine 4. Now another one that you can use with it is stomach 36, and stomach 36. Let's see if I can show you where this point is. Stomach 36, to find it, you can follow the edge of the tibia up, and you kind of come off the curve of that bone, more or less to the top of the extensor, or the tibialis anterior muscle. So right here is stomach 36, which is Zusan Li is what it's called. Which means foot 3 miles or leg 3 miles. So there's a number of possible meanings for that. One of the things I like to think about with that point, with the name of that point, is that if you rub that point, if your legs are tired, it allows you to walk 3 more miles. That's what Zusan Li refers to. Or maybe not miles, but it allows you to walk farther. So anyway, so that's Zusanli, which is stomach 36. Stomach 36 is also a command point like large intestine 4 is, but stomach 36 is the command point of the abdomen. So anything that's up with the abdomen, it makes it better. So it treats nausea and vomiting and diarrhea and upset stomach and cramping and all of that. So especially if you have a headache that also has nausea going on with it, or if you have like, you know, sinus congestion and drainage and that's upsetting the stomach, then these 2 points together would be great for treating a headache that goes along with those sorts of symptoms. So those are 2 great headache points: large intestine 4 right here in the hand and stomach 36 right here on the leg. Mostly for kind of sinus related headaches. So let's see, what other kind of headaches do we have? So I want to talk a little bit about small intestine 1. So that point is right here. I'll draw it on the corner of the nail bed. Can you see that little point there? This point is most often thought about being used for lactation. And so it helps with milk production. But it powerfully moves the small intestine channel, which runs along here, up the arm, all around the scapula. So if there's muscle tension in the scapula area, that can turn into muscle tension in the neck, which can turn into headache. So small intestine 1 is actually a great point. It's horrible to needle. I mean, people needle it all the time, but it's a really tender point, but it's a great one for acupressure, because it's not painful really to press it for acupressure, and it can really open up that whole channel and relieve all of that tension in the scapula area and up into the neck. So small intestine 1 is a good point for headaches that are kind of like the base of the head, and especially ones that are like this and also in the front, or that come up over the head and come, you know, kind of to the corners of the eyebrows, or this kind of area. And then some other points that can go along with that are urinary bladder points. So the urinary bladder channel starts in the corners of the eyes here, and then if you go up from there, the inner corners of the eyebrows that's UB2, urinary bladder 2, and then straight up from there just into the hairline is urinary bladder 3, and then just a tiny bit out from there is urinary bladder 4. So I like to use your UB2, UB3, UB4, all for headaches. And again, for this kind of headache that comes up over at the top, where you might have headache in the front and headache in the back at the same time, or it might feel like it's going, you know, all the way through like that. So you can use those points along with small intestine 1. So again, it can just be a little bit of pressure. Your body will respond to a little bit of pressure, especially in these. It just a little bit, and things will shift. You know, chi is a subtle thing, so it doesn't require a lot of pressure. And you know, but just a little pressure, and things will start to shift and start to move, and you'll be moving the chi in. This is actually in the urinary bladder channel, but small intestine talks to that channel too. So for headaches that are in the front and in the back, or up over the top of the head, those are some points that are great for that. What else do we have here? We have other kinds of headaches. Are gallbladder headaches. So gallbladder headaches are really, really common. They can be the headaches that happen with hangovers. They can be headaches that happen with being outside, like you know, squinting, being in the sun a lot, or being in the wind, or just general tension, like tension in the neck. Those can all lead to gallbladder headaches. So gallbladder headaches are on the side of the head. So if your headache is like in your temples, that's usually a gallbladder channel headache. So the gallbladder channel begins right in the, kind of in the hollow. I'm not going to draw this one on, but right in the hollow here, kind of straight out from the corner of the eye, that's where the gallbladder channel begins. And so pressure there can help to move the chi in the gallbladder channel. So usually gallbladder channel headaches, you know, they might be around the ear. They're often like across around the head here. They can be like a point right above one eye or the other, and oftentimes gallbladder headaches are just on one side. They can be on both, but sometimes they're just on one side. So gallbladder 1 is a nice point to use for a gallbladder headache. Gallbladder 8 and 9, those are 2 points that are right above the ear. Those are very nice to use for gallbladder headaches. The ones that I use the most probably for gallbladder headaches are a combination of Sanjiao or triple burner 5. So that point I will draw on and show you. The bone that goes to the thumb is the radius. So just in from the radius and 3 fingers from the wrist crease, that is Sanjiao 5, and there's that point. And here it is, it's right here actually, is where I'm feeling it. That point will help to activate a lot of the move chi that's stuck in the shoulder area and in the neck area. And then the other point that I use a lot for gallbladder headaches is gallbladder 20. So gallbladder 20, to find that point, if you find your ears and then go back behind the ears and you find a bump on the skull, it's called the mastoid process. And then if you go in from the mastoid process a little bit, you fall into a divot, and that divot is where gallbladder 20 is. So that point is called wind pool, and so that's a point that when you have a wind invasion or an external pathogen that's getting into the channels of your body, that's where it can enter and that's where it can leave. So we want to have that point nice and open, and that really, really helps headaches. This is probably the most common point I use for headaches, because very often headaches are a wind kind of a thing, and so we want to get that point open so the wind can leave the channels and not disturb the movement of the chi. So gallbladder 20. So that one is kind of nice to use a lot of pressure on, because those muscles there can get really tight if you have wind in that channel, or just tension in the muscles in general. But you also can work it very gently, especially if a lot of pressure feels like it's creating more discomfort. But that's a great point for gallbladder headaches, these headaches on the side of the head. And one other point I wanted to share with you as far as headaches go is liver 3. So liver 3 is called Tai Chong, which means great rushing, and it's another very, very commonly used point, and it's down on the foot. Let's see if I can show you where this is. I'll draw it on here. It's kind of in the web between the first and second toes. Can you see it? Okay, so if you go up from the place between the 2 toes and you kind of fall into a hole there, that's liver 3. So liver 3, or Tai Chong, great rushing, is a point that moves the liver chi really strongly, and very often disruption of the liver chi causes pain throughout the body, but definitely can cause headache. A liver style headache will often be a vertex headache or a top of the head headache. So if you're having one of those top of the head headaches, you can try pressing liver 3. It's often tender and it may feel good to use a lot of pressure, or again, you can just use light pressure and chi is subtle and it will respond to it. So those are a few points you can use for specific types of headaches. So I hope that you found this useful. Remember, you can always go online and schedule appointments with us at Flow at livelifeintheflow.jnap.com, and I hope to see you there soon. Good luck with your self-care, and let me know if these points help you out with headaches. Blessings.